Hi, everyone. Thanks so much for being here. As was said, my name is Kirsten Kingwill from the Department of Human Kinetics and Ergonomics here at Rhodes University. From Rhodes University. Today I'll be sharing on my master's research project in this presentation entitled An Engaged Research Approach to Understanding Patient Record-Keeping Systems in a Local Clinic in Makhanda. And my supervisors are Dr. Jonathan Davy and my co-supervisor, Mr. Andrew Todd. So the focus of my presentation, I'm going to be taking you through a couple background things like what is patient record keeping, human factors and ergonomics, and then moving on to participation in research, the aim of my study, and then some of my experiences in applying community-based participatory research. So starting off with patient record keeping. Healthcare record keeping is the process of recording patients' information, which is both a common and essential process in healthcare for a number of reasons. These include that they're medico-legal documents and therefore defend practitioners in legal claims. They communicate important patient information, and they contribute to the continuity of care and therefore play a vital role in the quality of patient care. However, unfortunately, within South Africa and other lower middle income countries, records are not always adequately completed, which means that they could contain erroneous information or simply be of poor quality. These inaccuracies could negatively impact patients and their families' lives, as well as lead to time-consuming duties taking away from other patients' care. For example, lost records have been shown to be as high as 1 in every 7 patient records. So there are many challenges within record keeping, and importantly noting that many challenges are dependent on context, but I'm going to share a couple general patient record keeping challenges. So these include an excessive burden of work, as one may skip over filling in certain information as there's simply too much to do. A lack of time to complete records, as there are often more patients to see and therefore may not be enough time to fill in all necessary details. Demotivation and fatigue from working. Inadequate access to record-keeping materials, such as the actual forms, stationery, maybe the printer's broken, things like that. And finally, a high number of patient admissions, coupled with a shortage of staff, which adds to one's workload and decreases the time staff have in order to complete records. So as seen through these emerging challenges, the healthcare record-keeping process has challenges that are complex and come from within the system. So in order to understand and improve the system, a systems discipline such as human factors and ergonomics is appropriate to apply. So what is human factors and ergonomics? The International Ergonomics Association defines it as the scientific discipline concerned with the understanding of interactions among humans and other elements of a system, and the profession that applies theory, principles, data, and methods to design in order to optimize human well-being and overall system performance. So based on this definition, there are 3 fundamental characteristics that HFE can be said to be based on. Firstly, HFE takes a systems approach, capturing and considering all interacting components that form part of a system. Secondly, it's design-driven, meaning that it aims to optimize work through system redesign. And thirdly, it focuses on optimizing both performance and well-being outcomes for humans within the system in focus. It's important to note here that performance and well-being are interrelated and can be achieved by changing work factors to suit the person, rather than the person to suit the work. So let's look at human factors and ergonomics a little bit more practically and what it means to take a systems approach. So as we can see here, within a work system, there are various components, such as the people performing certain tasks, using specific tools, and under different organizational, physical, and social conditions. So we take a systems approach by understanding all these components and how they interact with one another. They interact in various ways to perform the processes which ultimately affect work outcomes in a positive or negative manner, and they impact the organization, the worker, or the client, which in the healthcare context would be the patient. This is where design or redesign of a system comes in, as HFE aims to understand any problematic outcomes and then design work in order to reduce these outcomes and optimize the work. So HFE has been and continues to be applied in many industries that involve complex systems, therefore being able to understand, improve how organizations function. So using a systems thinking approach is helpful where interactions between all systems components can be understood. So as previously mentioned, HFE is design-driven, therefore designing systems for optimal well-being and performance outcomes. So within the context of human factors and ergonomics and attempting to understand and redesign a system, participation and working with the people in the system to understand their system is essential. So this participation and involvement of workers is crucial for successful HFE application, where participation in ergonomics involves working with those performing tasks and getting actively involved in problem solving to assist the development and implementation of changes in the workplace, which can improve productivity, reduce risk factors, and ultimately achieve desirable workplace goals. So due to this importance and involvement of participation in application of HFE, when conducting research from this perspective and applying HFE tools and methods, a participatory research framework is appropriate to implement. So there are many positive benefits that can come from applying participatory research in the HFE context, including improved worker motivation, improved production, performance, improved working conditions, design solutions, information flow, understanding differing stakeholder views, worker empowerment, worker growth and learning, and overall a reduction in risk. So the way in which I've approached this form of participatory research in an engaged manner, so therefore conducting research with people rather than on people, in order to address healthcare record-keeping challenges, is by applying a framework called Community-Based Participatory Research. So Israel et al. Lays out steps to explain this, and this diagram I've adapted from them. So step one would be forming a community-based participatory research partnership before assessing community strengths and dynamics, identifying priority local health concerns and research questions, designing and conducting research, feeding back and interpreting the findings, disseminating and translating research findings before sustaining, maintaining, and evaluating the relationship. It's important to note here that these steps do not occur in isolation, but they are overlapping as can be seen. One doesn't happen before the next, but they happen iteratively. So I just want to take a moment to pause here to explain how I began to even start studying patient record keeping. So for my master's research, I was invited to work with the Department of Health, where my supervisors had an existing relationship with a manager at the Department of Health due to working with him from a previous master's research. So as I'll explain later, we began to have meetings with this connection at the Department of Health, where we began to discuss challenges that primary healthcare in the Sarabatman district faced, and more specifically in Makhanda. And ultimately, we came to the conclusion together that patient record keeping was a large challenge that was faced and would be the focus of my research. So the aim of my study, little to no research has applied HFE through a community-based participatory research paradigm to understand record keeping in a South African context. Therefore, this project aimed to work with relevant stakeholders to understand a clinic in Makhanda, its record-keeping process, and barriers and facilitators to why patient records were not adequately completed by applying HFE theories and taking a community-based participatory research approach. Therefore, starting the conversation around how the record-keeping process could be optimized. So involving communities in this research by using community-based participatory research approach is essential and ethical in the context to gain perspectives of the staff working within the process on a daily basis. Unfortunately, due to ethical constraints of my agreement with the Department of Health, I am unable to share any findings as of yet. But what I will do instead is share how I've used community-based participatory research and a few things I've learned along the way. So what I've done here is I've taken the diagram and steps by Israel et al. And put my practical steps that I've taken, which I'll talk you through. So firstly, making contact with the Department of Health. As I explained, my supervisors had this connection, and we began arranging a meeting to discuss interest and if he would be interested in working with us again to understand challenges. So next we began meeting with the Department of Health. This occurred through 3 meetings, including later on with the facility manager, where we discussed challenges of primary healthcare clinics. As I mentioned, this was an iterative process, so I didn't have a meeting and then, okay, cool, we have a problem. We had a meeting, I went home, I read up, I had discussions with my supervisors. We went back to the Department of Health. We spoke about challenges again. And this happened over and over until eventually we met with the facility manager of the proposed clinic I could be working in, which I did end up working in, and decided that patient record keeping would be where I would focus. Next, I began to spend time in the clinic through embedding. This was last year. I spent about 35 hours in the clinic, really just getting to know people, spending time in reception, building trust, asking questions, just getting them familiar with me and myself familiar with them. What I then did was we decided that electing a advisor would be important within as a staff member of the clinic to help give feedback and guide me in my research, so emphasizing not me doing research on people, but with people. So what I did for my data collection was, there were 3 phases. The first was I did interviews with different clinicians and patient staff members to understand how the clinic ran, what it entailed, what was important about it, how they felt, challenges they faced. And this included more specifically the record-keeping process, which includes phase 2, where I created a hierarchical task analysis. So just understanding every step of the record-keeping process, where it starts, who it goes to, why it goes there, and so on. This brought me to my 3rd phase of record-keeping compliance. So what I did here was I spent a weekend in the clinic and used something called the Ideal Clinic Manual, which I adapted, where the provincial and the Department of Health comes in and assesses the clinic's record-keeping compliance. I adapted this and did a frequency count of different sections that were and weren't filled in. After this, I went back to some clinicians, which I ended last week Friday, but did a few more interviews trying to understand the sense-making behind what was or was not filled in as I found in the records. So this again was an iterative process of spending time in the clinic and getting feedback from my research advisor, and also within interviews asking, have I understood this correctly? Please, could you correct me? How can I do it better? When would it suit you? And so on. So this was a continual stage of feedback. So onto a couple things that I've learned. The first thing, as I said, I can't share any exact results, but I began to understand insights into why records are or are not adequately completed, and the sense-making behind why this was, and some reasons for why things were or were not adequately completed. So the next thing I learned is patience, which doesn't come particularly naturally to me, but it's something I simply had to become comfortable with, because the clinic didn't stop running because I was there, obviously, as it shouldn't have. But this happened through interview interruptions. So I'd go into an interview and someone would come and knock on the door, ask a question. The person I was interviewing had to run out, quickly do something, come back, and that was okay. And lots of rescheduling. Oh, sorry, come back tomorrow. Sorry, it's really busy. Can you come back tomorrow? Took a personal day. Can you come back tomorrow? And this was okay. I just kept going back until someone would help me. This is also reflected by Minkler 2005, who says it is called constraints on community involvement, where often the people we are working with actually are not in the position to give of their time and energy, because a huge constraint is time. So the next thing I learned was listening, which seems quite obvious, particularly when working with people, but I found it to be so important, because even if someone wasn't answering the exact question I was asking, listening instilled, and really listening to what they said was a willingness to continue to working together. Okay, this person is listening to me, they care, I'm going to keep answering their questions and chatting and just having discussions. And the second way was any insights into a system are important insights, even if it's not exactly what I'm looking for. The last and final thing is feedback. I've been through all phases of data collection, but I'm not done working with people yet. I still need to interact with all levels of people, from the Department of Health to the advisor, to the facility manager, to my participants, if you can call them that. And challenges around this is how best to share and release findings with the community, as also reported by Minkler in 2005. And this will be my next challenge and upcoming thing. Thank you so much.
Thanks, Kirsten. I think we've all learned a lot about how to practically do CBPR. And it's really lovely to see that happening at a master's level as well, which is quite unusual in some respects. So well done for tackling that. Are there any questions for Kirsten? Or advice and suggestions? So there's a question there, and then we'll go to Nicola there.
Can I answer? Sure. Thank you.
Hey, Kirsten. So I heard this for the first time, and it's amazing. I know we've been chatting in the department throughout. Just a question that came up now when you were mentioning the process of embedding, and you have shared the value in embedding, and perhaps if there's something else that you'd like to share on your experience during embedding, and if there are any, not necessarily cons to that process of embedding, but just your experience, and if there is the other side, because there is the good side of building relationships, but I'm just curious to know if were there any negatives during that process, or do you think there is a not so bright side of the embedding process?
Really interesting question. I think overall the outcome of embedding, I didn't necessarily see it until I started doing interviews. And sometimes it was awkward because things carried on, and I kind of just went and sat in reception and was like, hi. Sometimes I felt like the reception was so small I was taking up a seat, and I didn't want to be a burden to anyone else, but I knew the value in it at the end of the day and just tried not to get in the way. And if I could see it was ridiculously busy, I kind of just made myself scarce. But I also helped out. The advisor at one point, before elected an advisor, came to me and said, come, I'm going to teach you how to draw files. Here's the file number. This is our system. Go for it, find them, put them back. So I think the value in it and building that relationship outweighed any awkwardness at the end of the day.
There's a question on that side. So we'll go to Nicola, and then I think Caesar has a question, and then Jonathan has a question. But let's start with Nicola and give Kirsten a chance to answer that question first.
Thank you. A really important topic. I know your research is not finished, but just, at this stage, what can you recommend? We're all very aware of the poor record keeping and things going lost and so on and so on. What can you recommend?
That is the hardest and most dreaded question, but I don't think there's a perfect answer. I only finished data collection on Friday, so I haven't sat down and really put together recommendations. But I think there's no perfect solution. Everyone thinks, technology, but that's not perfect in the context. There is no perfect answer, so I don't have an answer yet for you, if that's okay.
Caesar, and then we'll go over there.
Thank you for your presentation. It's great. As you are about to finish your work, there's a thesis published in 2021 about record management or record keeping of Cecilia Makhanda Hospital. If you can look at that, it might add value in what you are currently doing, because I just listened. It's very similar, and you will get a lot of guidance in the findings of that document. Moving forward. It's written by Nabagaze Jonga. Yeah.
Thank
at
you so
Fort Hare
much.
University.
I'll definitely look into that.
Thanks.
Wonderful. Jonathan, and then we'll come to Catherine.
Thank you, Kirsten. I just wanted to answer the question about what to recommend. And while we can't say anything about the record keeping, I think it's to be in awe of what healthcare workers in this country, particularly in public healthcare, have to contend with, and the constraints under which they work, and how they effectively are the glue that keeps our public healthcare sector together in spite of all those constraints. So that would be my first recommendation, is to just be patient with them. And just to commend you, Kirsten, because I know we can't share what we found, but I think the fact that some of what has been said to you in that final phase is incredibly powerful, but it also reveals an incredible amount of trust that the healthcare workers have put in you because of the fact that you have shown up each and every week in spite of the constraints. So this is just a shout out to you for a job well done in that sense.
Thank you.
This is going to be our last question, because I see people coming in for the last little bit and wrapping up the conference. So let's take the last comment and question.
Yeah, very brave research. And I just wanted to know about, maybe in terms of your methods, the dating for when you would pick to look at the records, and kind of how you went about reassuring the healthcare workers around, I suppose, no ramifications from their poor record keeping. I'm just, cringing to think of somebody looking at my notes.
Yeah. I've skipped over it a little bit because of time, but at each stage of collection, including when I actually sat and looked at the records, I went into a staff meeting, which happened on a Wednesday afternoon, and explained that this would not come back to them. And even within interviews and at every stage, I just reiterated that they would be anonymous and that this would not come back to them. And I couldn't share findings, and it wouldn't go to their manager or anyone else involved. So I think just that reiteration of it's okay. I'm just here to learn as well. Yeah.
Thanks. I think, this is a lot to learn from, and it's so lovely to have this project take place in our own city. So thanks for sharing with us and letting us learn from you. And that brings us to a wrap of this session. Thanks for joining us. I'm not sure if other venues are starting to join us, but maybe we should open up the doors in case they are ready to join us. Or is this everybody? I'm trying to get the computer to work. I have emailed everybody a link to a short conference evaluation. I'm going to try and get it on the screen now to get a code. Okay, great, it is up. So if you can quickly do the evaluation, the right-hand QR code, or you could put the bit.ly link in, otherwise open up your emails. There are multiple ways to access it. Really doesn't take long. It's 3 questions that you can answer in a few sentences and some multiple choice type questions. Shouldn't take you longer than 5 minutes. Would really appreciate that.
Sorry, I didn't mean to quieten you. Good afternoon, everybody, and greetings to you. I'm going to do my task was to do the consolidation, but I'm a bit gobsmacked after Dr. Suleiman's presentation. I just feel like we've been hit by a tornado internally, not mentally, internally, and shaken up a bit about how we should be thinking about community engagement. He stood here as one of the best community engagement person we know of. So let me just start then to get my thoughts together with the basics about the conference itself. So the title was Community Engagement, or the main theme of the conference, Community Engagement and the Trajectory of Community, University, Society Relationship, Past, Present, and Future Possibilities. And based on that main theme, we had four sub-themes that covered the following perspectives: conceptual, pedagogical, ethical, and social responsibility. And those sub-themes had a number of questions which your presentations and your abstracts actually addressed. From these four perspectives, we had more presentations, abstracts and presentations on the pedagogical perspective. I think people felt more comfortable presenting in that area, and that was followed by the ethical and social responsibility perspectives. So the conceptual bit, I'm not sure, because it did cover what the main theme, a part of the main theme was the past. And we had fewer abstracts and presentations on the past of community engagement. And I'll come back to that issue of the past in a few minutes. This year, we've had, as Di said, somebody asked about the monument and using this building. As Di mentioned at the beginning of the conference, the reason that we had to look for another venue was the number of abstracts we received. There were many, many more abstracts than last year. Last year, we accommodated, the conference was held at Amazwi, and it had 2 breakaway rooms. This year, because of the number of abstracts, we had to have more breakaway rooms. That was one, the number of abstracts we received for this year's conference. And what was also interesting is that we've had more abstracts from different disciplines. And this actually shows the movement of community engagement from previously the focus on the social sciences and humanities. We've had abstracts from focusing on STEM. And yesterday I attended a presentation briefly on engineering, and I found that quite interesting, to get engineers involved in community engagement. These are just some of the ones that I thought were a variation now from the normal social sciences and humanities. when we were looking at the abstracts, and I remember asking Renee and Thandi this, invasive alien plants and community engagement? I mean, how do they go together? But we actually had an abstract with community engagement and invasive alien plants. And it was very interesting to have a presentation from a private higher education institution and the relationship with community engagement and universities that are involved with community engagement. Biological controls to clean water. And lastly, the last presentation that we had, patient record keeping. I mean, who would link that to CBPR and to community engagement? I mean, 2 or 3 years ago, we wouldn't even think about that relationship. So quite a good variety, and it shows the movement of community engagement into more disciplines in a university. And then we went across boundaries also. We had Mateus from Chile, and everybody knows Mateus by now. We've got Margaret from Kenya, and in a way, I'm quite sad and disappointed that we didn't get our presentations from Tanzania and from Uganda, because the Tanzanian presentation with the focus on Julius Nere's Ujamaa was very critical to our understanding of community engagement in the African continent itself. So we went across boundaries in this conference. Some highlights. One, I want to start with the formal lecture, and for those that were here, with the formal lecture presented by the CE Community Engagement Awardee, Rhodes University Awardee. And she highlighted the combination of head, heart, and hands in community engagement through teaching and learning and research. I mean, this is something new also that hasn't been, may have in 1 or 2 cases, but not as clearly articulated, that community engagement is the combination of head, heart, and hands through teaching and learning and research. Our redress community engagement passed the CE project. So we've had, even though there were few, there were very interesting ones. The one by Martina and the Reverend on the history of Mamelodi, the visual redress of Stellenbosch University's project, redress and restitution, and Claire's presentation today, the historical ideas of community. And that were very interesting presentations. Another thing about the presentations is that more of them had theoretical underpinnings attached to them. So it shows clearly that we are building a body of theoretical or theories for community engagement. And actually that is quite encouraging. We've had more abstracts and presentations in storytelling this year. Storytelling and the posters. And storytelling is actually quite an important method of community engagement. And this is also encouraging when we can understand community engagement through storytelling, which is a powerful medium. So that is some of the findings of the presentations itself. I want to go to the keynote speakers, and I want to mention why I felt gobsmacked is that we started with Professor Andre Keat and Dr. Suleiman. Then we had the DVC of teaching and learning, and we had the DVC of research, Rhodes University. And in between, we had Margaret. And there was this flow, and I just felt like all of these people may have sat the night before together somewhere, met and thought about, okay, this is the message that we're going to send to this conference that is happening in the next 3 days. But of course they didn't. But the message was very, very strong. Let's just start with Andre. Andre saw this very strong link between community engagement and transformation. And that transformation and community engagement, he saw community engagement and transformation as co-authors of a reimagined university. And this reimagined university, that community engagement could bring about, has to actually look at this through changes in institutional structures and institutional culture. See, we cannot continue with community engagement if we don't critically examine our institutional structures and our institutional cultures. We can't talk engaged research if the culture remains the same, if the structures remain same. We can't talk service learning if we don't put the word critical service learning in front. You know, service learning, we should actually rethink the use of the definition of service learning, Tim, with no disrespect to you, that we've been using from the American context for so long. We have a history, we have a context. What purpose do we actually want service learning to play in our country, in the African context? And therefore, it has to be critical service learning, where students are taught to ask, why is such a situation is the way it is? It's not just taking what is taught in the lecture room about your discipline and going and using it with communities to see what difference can it make. Why aren't we teaching students critically to think about the knowledge that they are gaining? And when they go out into the communities, why is this context the way it is? You know, why isn't there any change? Poverty, inequality, unemployment, corruption, other social ills have been perpetuated for decades in this country. Are we making any difference? And this is what Andre was trying to say. It's time that community engagement started seriously contributing to a reimagined university, not universities as they are. So what does this require? Do we have the courage to do that as a community engagement sector? We were talking, I heard this conversation going on about the structure for research ethics and you know, but do we have the courage? This was a conversation we were having in our transport, the small group that were being transported together. When you get to a stage individually, when the institution's leadership structure, executive structure actually tells you what you are thinking and what you are trying to do is extremely radical and it could affect your job, would you ever think of a reimagined university? Do you have the courage to do that? So these are questions that we have to ask about community engagement and what role does it and can play in the reimagination of a university. We seriously need to continue with this dialogue on the effectiveness and the impact that community engagement makes, not just with the university academics and the students, very important, the impact that it makes on the students, and how effective is it for us, and this word graduate attributes also, we need to re-examine that. How do we contribute to educating the human beings that we call students holistically, their entire development holistically? So does CE, what impact does CE have on this education of students? Di mentioned educating for life and for a living. Do we seriously think about that? So I know that word classification actually puts me off also, but what we need to do is we need a framework, a national framework that can be adapted to context and institution to look at, even the word measurement, it's not quantifiable. How effective are we? Are we making the change that is required in communities, with communities? How are we making an impact? How much are we shifting poverty? How much are we shifting inequality? And how much are we shifting unemployment? When Darren and I presented, well, Darren didn't, but if you looked at what the Black Consciousness programs were about, it incorporated social, cultural, psychological, economic development. So it has to be properly planned and thought through. So that dialogue is very important, and it needs to progress. Now that we have USAF on board, we hope that we can make good progress on creating this framework for how we look at whether we are effective and whether we are making an impact through community engagement. I want to talk about Margaret's presentation. So Dr. Suleiman used the word spirituality and faith. And when Margaret did her presentation, this part really got me thinking when she said, let me get to your notes, Margaret, that I took. Decolonization research. There were 4, Margaret, can you help me out here? With the individual, you had a diagram that showed, oh, here's it. Our sense of self, our identity and belonging. These questions we need to ask ourselves individually. And this is in line with what Andre talked about, self-reflection. Each one of us need to do this seriously, reflect on who we are and how we do our work, and then institutional reflection. And this links in with, Margaret used the word spirit, Andre did it, but he talked about institutional culture. Where do we come from individually? Who am I? My sense of belonging. And where am I going to? If we don't do this individually, she said, how can we ask these questions about us collectively? So where do we come from? Where are we going? What is our sense of belonging? Right? And where are we going? So the word spirit has been quite strong in this conference. Margaret, Andre didn't say it in that way, but he actually said, when you do self-reflection, you're going deeper into yourself, okay? So you're in touch with your inner sense, your inner being. So there are a couple of questions that we have to ask ourselves as a collective. is how do we have the courage? And that's the first thing, as a collective. And are we a collective? That is the first question we have to ask ourselves. Quite honestly, some of us work from a very shallow sense of what community engagement is. Some of us have a medium level of understanding. And I'm saying this only because community engagement, formalized community engagement, is a recent happening in South Africa. You know, if we had the years that teaching and learning had and traditional research, I wouldn't be saying this because everybody would have given this deep thought. And it's time for that now, this deep reflection and thinking, you know, from moving from a shallow, getting deeper into understanding community engagement and seriously asking questions. Asking this one very important question, do we have the courage as a collective to contribute to the reimagination of a university? So that is where I will leave you about the conference. I want to just say something about the African Journal of Higher Education Community Engagement. For those who haven't looked at the journal properly and the first few pages, I'm the chief editor of the journal. And I've been going around asking people, listening to their presentations, are you prepared to write a paper, a manuscript for the journal? And everybody that I asked were very happy. But I would like to put this across to everybody. Please, if you are interested in publishing from this conference a paper, and from this conference what we intend to do is publish 2 issues. You see, we did say that the journal will be published annually in November, but we have enough quite exciting presentations for 2 issues, one in November and one in June maybe next year, and also for a book on community engagement. Okay, so anybody who is interested, I will approach all of those. I will send emails to all the people that I've approached, but I didn't have the time to go to everybody. So anybody who is interested in the journal itself, you all have a copy. You have an email there and contact details for the journal. There's a Rhodes editorial team. Please contact us and let us know if you are keen to participate in it. You see, once the June publication is done, then we have 3 publications. Then we can start our application to DHET for accreditation of the journal. Okay? So thank you very, very much for all of those who agreed, and we hope that we get a lot more saying that we want to contribute a paper for the journal or we want to contribute to the book chapter. The last thing is this, that somebody asked me while we were talking about, as you heard the DVC teaching and learning talk about the postgraduate diploma in higher education community engagement has been accredited by SACWA. And Rhodes University Community Engagement will be offering it in 2025. And it is online. It can't be okay. It's going to be offered online. Anybody nationally, regionally, and internationally can participate in this PGDIP program. Thank you.
A last word from me. Are you exhausted? Your head full, too many tabs open. I know the feeling. I'm feeling like that as well. but still so inspired. So it's been 2.5 days. It was only 2.5 days ago that you arrived here and started with the conference. I'm sure it feels like much, much more. You brought us 70 presentations, 70 quality presentations, 3 dialogues, and 7 keynotes. Each one rich, varied, and thoughtful. That accumulated effort from all of the participants in the room today. Thank you, thank you, thank you for all the planning and research work that went into each one of those presentations, the dialogues, the chairing of sessions, and the participating in general. Those who've traveled far, I know South Africans have come from all the provinces, and many of you have traveled here. The SRC took 2 days to get here, I think, on the way. I won't mention all of you, but let's mention those who've traveled from abroad. Matthias, who's traveled all the way from Chile via the US and back, and between those 2 countries. It's not the last we've seen of you, Matthias. To Margaret and Daniel, it's been lovely having you all the way from Kenya. Marisol from the US, Tim Stanton, also from the UK. Thank you all sincerely for the investment you've made in being with us today. We really want to grow the South African space and put our arms around the whole of Africa and all of those who believe that the South can begin to generate very exciting models and knowledge and to share as equal partners with the North. To the National Arts Festival for this lovely space and accommodating us at the last minute when we realized we couldn't fit into a Mazwi. The Rhodes Kitchen for their catering. And then to the Roost team. It's been 4 or 5 months of lots of hard work. To each and every one of you. You have been incredible. We've had team leaders from each little section, and you've really made us proud. Thank you so much. And then in closing, I must say Dr. Suleiman had the same effect on me. But I loved it when he said, you know, the community engagement work is the language of the heart. And as we move forward, you know, that we will sometimes find ourselves working in spaces where people just use the head and the hands. And just to remind them that what it's going to take to heal our country and to build it into its full glory is the head, the heart, the head, the hands, and the heart. And if we can all go away, the best way of teaching is just to be the change you want to see in the world, as Gandhi said. I was so encouraged in the first keynote with Prof. Keert. I kind of knew it, but it was nice to hear him affirm it when he spoke of the importance of reimagining higher education so it can begin to build the kind of society that where everyone can prosper. And when he said it's going to be community engagement, that helps us to drive that change. So as you go away, it is a responsibility. And it's something we aren't going to take lightly. You wouldn't have been here if you felt you could take something so big and so important lightly. So as you go away, know that what the work that needs to be done and get stuck in. Thank you all once more for a wonderful, wonderful conference. You have made it such a rich and rewarding experience. Then I'm just going to share some logistics. Renee, would you like to mention anything about lunch, or shall I just do that? So we have packed lunches for you. So as you leave, you can take your lunch, or otherwise you can find a nice space in the Yellowwood Terrace and stay and chat a little more to any of the colleagues you haven't been able to chat to. But please travel safely